Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Aisyah Meilina from nursing class 21 with a name 012111052. Here I would like to present antenatal, postnatal, and the newborn nursing care. Okay, let's start it. Antenatal care. Antenatal care is health service provided to pregnant women periodically to maintain the safety of the mother and fetus. ENC examination is a planned program in the form of observation, education, and medical supervision to pregnant women in order to obtain a safe and satisfying pregnancy and childbirth process. Analysis data. Client name is Ms. S. Medical diagnosis anemia, antenatal, and date of February 22, 2023. The first analysis data is DS. Patients said they did not know about anemia during pregnancy, and the DO is the patient appears to frequently ask about the problem at hand about anemia. The second is the DS. The patient says she often gets dizzy, increased intensity of dizziness, and then after limbs. DO, the patient looks pale. And the third, DS, the patient complains of sleeplessness and frequent wakefulness. And the DO, the patient eyes back appear blackened. A problem and etiology. The first cannot deficit at the number D0111, lack of information about anemia during pregnancy. The second is risk of infection. The number is D0 D0142. And the third sleep pattern disorder with a number D0055. And then that is related to etiology. The first is lack of exposure to information. The second is secondary defense, inadequate and decreased hemoglobin. And the third is lack of sleep control. And nursing care plan and evaluation SOAP. Nursing diagnosis. The first knowledge deficit about anemia in pregnant women is related to lack of exposure to information. And the nursing action is identification of readiness and ability to receive therapeutic information. And the second is provided opportunity to ask questions. And next, use health promotion approach. And then encourage health program in daily life. And for the evaluation, S is the patient said that she already knew and understood about anemia and pregnancy delivered by the midwife. O, the patient seemed cooperative and actively asked questions. And the A, problem solved. P, intervention dismissed. And the second diagnosis is risk of infection related to decreased hemoglobin. And nursing action is in the identification of pregnancy risk factor, identification of obstetric history, monitor psycho and psychosocial status during pregnancy, discuss labor and birth preparation, encourage self-care to improve health, teach to recognize danger sign. And for the evaluation is as patient says she often gets dizzy and feel weak. O, client look pale. And for vital sign is blood pressure 87, 87 slice 41, 51, and then the pulse is 76, and the breath saturation is 20, and then the temperature is 36 to Celsius. And the A, the problem has not been resolved, and the P, intervention continued. And the third diagnosis is sleep pattern disorder is related to lack of sleep control. Nursing action, identification of sleep and activity patterns, identification of sleep disturbing factor, environmental modification, AG lighting, noise, temperature, mattress, and bedding. Adjust position to reduce darkness, AG semi-polar. And then teach how we use good posture and good body mechanism during position change. And for evaluation is as patient say difficultly sleeping and often awake, or the patient is back pure blackness, and then the patient face look lethargic and sleepy, and the A, the problem had not been resolved. And for the P, intervention continued. Now we are moved to postnatal care. The puerperium or postpartum period is also called puerperium, which comes from the Latin word puer, which means baby, and porus means giving birth. Puerperium is a blood that comes out of the uterus during the childbirth or after childbirth. The puerperium begins the placenta is born, and the end of the gynecological apparatus return to its pregnancy state. The perineum lasts approximately 6 weeks or 42 days, which is the time needed for the gynecological apparatus to recover to its normal state by Ambarwati and Wulandari 2010. We come into analysis data. The part TX is DS. The patent complaints of pain in the perineum or suture part, and the DO patent appears to be grimacing. And the vital sign is blood pressure 119 slice 81, and the pulse is 75, and the temperature is 36.7 Celsius. And then the second DX is DS, decline complaint of discomfort and chills, and DO, decline look restless. And the third DX is DS, decline said she worried about the perineal area because it was the fifth childbirth, and the DO, the perineum looked clean, and the perineum there was a little abrasion with a little blood coming out. Okay, the client name is Miss A. Medical diagnosis postnatal, and the date February 23, 2023. The problem, acute pain with relate to etiology psychical injury agent. The second is disordered sense of comfort is related to this disruption of pregnancy adaptation, and then the third problem is risk of infection, which is related to etiology tissue trauma. Nursing care plan and evaluation is OAP. The first diagnosis is acute pain related to psychical injury agent. It's taken into pain management, is identify the location, characteristic, duration, frequency, quality, intensity of pain. Identification of non-verbal pain response. Identify factors that aggravate and elevate pain. Control of the environment that aggravate pain, e.g. room temperature, lighting, and noise. That teach pain relief strategies. An evaluation is as the patient say it still hurt, but the pain feels mild. O, the patient appears to be grimacing, and the vital sign in blood pressure 119 slice 81, and pulse is 75. A, the problem of pain is partially resolved, and the P, intervention continues. The second diagnosis is discomfort is related to this description of pregnancy adaptation. We take into relaxation therapy. Identify of decreasing energy level, inability to concentrate or other symptoms that impair to cognitive abilities. Identify relaxation techniques that have been effectively used, and then create a calm and an uninterrupted environment with comfortable lighting and room temperature. And then current assumption of comfortable position. And last is encourage relaxation and unwind. Evolution, the S is patent still complain of discomfort, and O patient appears to be able to perform relaxation techniques. And A, the problem has not been resolved, and P, interpretation continues. And the last diagnosis of postnatal is risk of infection that relates to tissue trauma. Taken to postpartum care. And the first, monitor vital sign, monitor the state of lochia. Check the perineal tears of laceration is reader. Identify mother ability to care of baby. Explain few dangerous signs to mother and family. And last, teach proper perineal care. And for the evolution is as patients say they still feel pain, and patient is not worried. Oh, the perineum cleans and there is no swelling or edema. And then Lucia rubra with the red color and liquid consistency. A problem partially resolved and the P intervention continued. Okay, we move to the last part. It's newborn. Newborn is the period of the baby first life outside the womb until the age of 28 days, where there is a very big change from life into the womb to outside the womb. During this period, organ maturation occurs almost all systems by Cunningham to 2012. A normal newborn is a baby born with a gestational age of 37 weeks to 42 weeks, and a birth weight of 2,500 grams to 4,000 grams. And analysis data is the birth DX to DS. The baby model said that sometimes the baby seems to be suffering from the cold, and the DO baby skin feel cold and baby looks shivering. And then second DX to DS, nothing, and the umbilical cord appear clean, area around umbilical cord appear clean and not red, and then cord does have a strong odor. And the treat DX2 with a DO baby looks calm and body weight is to 2003 kilograms, and then the body height is 48 centimeter, and nausea negative, vomiting negative, deficient smoothly, and baby suckling strongly. The client name is baby T. Medical diagnosis newborn, and date of birth is February 22 of the 2023. An analysis data is take to risk of hypothermia that is related to newborn unfitness, and the risk of infection is related to primary body inability, and the last is risk of nutrient deficit is related of the body to decrease nutrient. Nursing care plan and evaluation is OIP. The first diagnosis is risk of hypothermia related to newborn. We take into hypothermia management. It refers to monitor body temperature, identify causes of hyperthermia, e.g. exposure to low ambient temperature and thin clothing. Monitor sign and symptoms due to hypothermia, provide a warm environment, e.g. adjust room temperature incubator, and then perform passive warming, e.g. blanket, heat covering, and thick clothing. For the evolution is as the baby mother says that baby seems to be suffering. and the object is baby's skin feel cold, and the temperature is 36 uh, Celsius. That is not normal for a newborn, and the baby pulse is 126, and the saturation is 46, and the baby has been given a blanket and the air conditioner turned out, and the A problem solved, and the P intervention terminate. The second is a risk of umbilical cord and infection, which is related to primary body immobility. And the nursing action is infection prevention. The first is monitor sign and symptoms of infection and provide a safety technique to hide a risk. The maintain a setting technique, teach mother how to check condition, and identify if recommend increasing the baby nutritional intake to breastfeeding. And the evolution is as mother says she can and understand how to care of the umbilical cord, and the old umbilical cord and surrounding area looks clean, and there is no infection in the umbilical cord. Umbilical cord looks still wet, and then does not smell bad. With the A problem solved, with the P intervention terminate. And the last part is third, risk of nutritional deficit, which relate to of the body inability to get nutrient. Is taken to nutrition management is the first is identification of nutritional status, and then give high calorie food, monitor body weight, monitor laboratory test result, and then collaborate with a nutritionist to determine the number of calories and type of nutrient need, and if necessary. The evolution is as baby mother says baby is active, oh baby is gaining weight, and examination results are good, just need a lot of nutrition, and the baby is whiny, active with a frequent crying. The baby bowl move in smooth, and baby seem to suck and suck well. And the A problem solved, and the P intervention dismissed. Now that's it. To antenatal, postnatal, and newborn nursing care. And I apologize if there are any shortcoming or any mistake. Thank you for information. Thank you for attention. Wassalamualaikum warahmatullahi wabarakatuh.